Hello, you're very welcome to my YouTube channel today, Narcibi's Desk, where I post useful information about cancer and every other topic that relates to cancer. So in today's video, I'll be talking about the warning signs of colorectal cancer. Initially we used to talk about the cervical and the breast cancer for the women being predominant, and then for the men we used to mention cancers of the lungs and prostate cancer being very rampant for the men. But today, in recent times, in my everyday interaction with my patient, I've come to find out that colorectal cancer has become one of the so many rampant diagnoses for our patients of recent, like I said. So that prompted me to make this video, okay, so that I'll share with us the warning signs, things you notice that is showing like that there is a problem in the rectum or the colon. Okay, so these are the things you'll likely see early, and then you report to your healthcare provider. But for you to benefit from my video completely, I would urge you to watch my video till the end. And if you're new to my channel, please you're very much welcome to my channel, and don't forget to subscribe to my channel so that you follow me up each time I drop useful videos. And also don't forget to turn on the notification bell so that you'll be getting notification if I drop new contents in my channel. Okay, like I said earlier, that I'll be sharing with us the warning signs of colorectal cancer. Colorectal cancer symptoms may be minimal or non-existent during the early stages of the disease. The early warning signs of this disease includes both systemic and local symptoms. So I'll start by telling us the local symptoms first. The local symptoms for colorectal cancers include the changes in bowel activity, which could be in form of constipation or diarrhea. And also it could even be alternating diarrhea and constipation. That means these two may come hand in hand, it may play together. Having constipation means you're not able to pass a stool, you're not able to move your bowel for some time, which is not very good. It's very harmful to the rectum. It's not very safe. Yes, environmental changes and other factors could influence your inability to pass stool every day, but I urge us that if you eat good food, you aware of anxiety, okay, I'm very sure you're going to be able to move your bowel, because it's very safe for you to move your bowel because you eat every day. Just eat good food, eat normal diets that would help you to promote good movement of your bowel, and you find out that you're not going to constipate. And for people that may have diarrhea and they feel, oh, I've been having watery stool for some time, it is very good to report to your healthcare provider if you notice you're passing watery stool even more frequently, like 3 to 4 times a day, or you're doing this for like a long period of time of about 1 week. It is very good to express it to someone closer to you, or you talk to your healthcare provider so you get treated on time, because whenever there is an irritant in the body, this is when the body shows different symptoms, so you have to report to somebody. So I want to talk about the second symptom you may notice, which is always there, is the rectal bleeding, or you have occult blood in stool. The occult blood in stool means that there is a blood stain in your stool, or you're bleeding from the rectum. It is very good for you to report to a nearby physician. It is not very safe for you. And another sign is abdominal bloating. You may have abdominal bloating when you eat something that have gas, but when you notice that this bloating has been there for some time, it's very good for you to report to your healthcare provider, because it is not very safe. Because this happens when there is a content in the rectum that has not been able to be emptied. So that's when your stomach tends to bloat. You feel so much discomfort, like you're not comfortable because there is a gas in the stomach, there's something in the stomach. Okay, so that's when you report to your healthcare provider. So another symptom is when you have a feeling that your bowel doesn't empty completely. You've gone to the loo, you've emptied your bowel, but you still have that feeling that there is something in your rectum or in the bowel that you've not completely emptied your bowel, and it's been there for some time. It's been there for a period of 2 weeks, 3 weeks. You've been feeling like this. It is not normal. Don't try to guess. There is no guesswork, okay, when it comes to your health. So you have to play smart and then talk to your healthcare provider so you get treated on time. And then another one is when you have a feeling of cramps or discomfort, pain in your abdomen, you have this abdominal discomfort, abdominal pain, it is something that you have to report to somebody if it persists. Okay, there is no need for you to do over the counter analgesic. Okay, you try to treat something, because when you do analgesic, it's just going to take away the symptom of pain, but then it will still make the problem persist and even more dangerous to us. So it's better to talk to somebody, get scanned, okay, and get to find out why you're having those cramps for this period of time. And then another one, which is always there, is when you have stool that are thinner than normal. We call it a ribbon shaped stool. Okay, you go to the loo and then you pass a stool and you notice your stool is very thin. Do you know why it becomes thin like that? It's because there is a tumor that is occluding the passage for your stool. So that now makes your stool to acquire that ribbon shape. Okay, so when you find out that you're having a long time, for a long time you've been having those ribbon shapes too, so it's good for you to talk to your physician and get treated on time, because we have to know what is there and then sort it out. Okay, so that's for the local symptoms. So I'm going to quickly mention to us the systemic symptoms that we can find when you have the colorectal disease. We have unexplained weight loss. You lose weight and you don't even know what the problem is. And you also have a symptom of unexplained loss of appetite. The food you've been tolerating for some time, you see the food and you're not eating, you don't have that feeling of eating your food, or you try to eat but you don't have the craving for it. Okay, so that means there is a problem. Okay, so then another one is nausea and vomiting, or you can put it nausea or vomiting. You have the urge to vomit. Okay, that's when you're talking about nausea, when you're retching. And then you also, or you may be throwing up. Okay, that means there is something in there that is not allowing something else to come in. So that is called nausea and vomiting, and you have to report to your healthcare provider if you've been not vomiting for some time. You don't have to say, oh, probably I have malaria, and you keep treating malaria for a long period of time and you notice you're still having this symptom of vomiting. Okay, so another symptom that accompany colorectal cancer is anemia. Okay, because cancers, they have this characteristic of making their own blood vessels and then taking up the blood from the system. Okay, they suck blood because they want to grow and become larger. Okay, so that is when you have anemia. You experience a symptom called anemia. You're becoming pale. Okay, you look at your conjunctiva, you're becoming whiter, you're becoming pale. So you have to report somebody is not normal. And then the symptom of jaundice. Okay, you find out that your eyes becomes yellow, your stool is yellow, even your urine is yellow, dark yellow. So you have to report to somebody that's jaundice. And then you talk about weakness or fatigue. This may come together because when you're weak, you're likely to have fatigue. This fatigue is when you rest, and then even if you rest for a whole day, you still wake up feeling tired. Okay, that means there is something wrong. So understanding cancer symptoms, I'll talk about when you to understand cancer symptoms. Okay, the difference between cancer symptoms and every other symptom. These symptoms may be attributed to a number of conditions other than cancer, the symptoms I mentioned previously. But however, if you notice any cancer symptoms, if you notice any of these symptoms, okay, there is nothing that you don't try to do a guesswork. Like I said, it is important to visit your healthcare provider so that you be provided with accurate diagnosis and get treated on time, because we normally know that early treatment is the key and it sucks for a successful treatment and management of cancer cases. So thank you very much for staying put with me till the end of my video, and I look forward to seeing you share my videos to reach others, because there are people out there that would be needing this information, and it is very helpful and will be very helpful to someone else. And please do help me, give me a like, a huge thumbs up if you find my video interesting. Bye.